Good afternoon and welcome to the presentation called Automate Your Outcomes and Impact. The IT guy or gal is your friend. And I'm Debbie Thompson, the president of Strategy Solutions, and I'm delighted to have the opportunity to be here with you today to talk about one of my favorite subjects, and that's really automating outcome and impact indicators. And today we're going to cover four basic things. We're going to talk about completing a self-assessment to talk about how well equipped you are to automate outcomes and impact measurements related to your community health needs assessment implementation strategies. And the first few slides after the introduction are actually copies of an assessment tool I created for a pre-conference workshop for the Association for Community Health Improvement a few years ago. And that, along with some of the examples of the reporting that I'm going to talk about later as a case study, will be available to all of the participants along with all of the slides from today's workshop. So you'll be getting those from Kathy in my office after the presentation is over. And in addition to conducting that sort of self-assessment, that we're also going to look at some specific outcomes and impact indicators related to what we call the triple aim, and thinking about that kind of impact. We're going to talk about strategies to integrate selected indicators into existing electronic medical records and information tracking systems, and give you some tips and tricks about how to facilitate some discussions with IT professionals to help you get what you need. And then the last few slides talk about how to develop an action plan to implement or improve the outcomes and impact measurement systems in your organization. So this is one of my favorite presentations because it really talks about, how do we make what we're doing a little bit better. And all of these series of presentations that we've been doing over the past few weeks to support the CB Tracker group is really based on the spirit of the law of the Community Health Needs Assessment IRS guidelines. Yes, we know from the letter of the law we have to do certain things every 3 years, and the IRS says. But really what the spirit of the law is doing is encouraging us to move toward a population-based planning and delivery system to really focus on prevention and to manage the health of a population so that we can lower health care costs, improve quality, and improve health status, which is the triple aim. Now, one of the things, if you take away nothing from this webinar today, one of the things that I want you to take away with is if you're collecting outcomes and impact measures in an Excel spreadsheet, that is not automation. I've had people in programs say, well, yeah, our outcomes measures are automated. We have them in an Excel spreadsheet. That doesn't count. It really only counts if you are actually tracking and reporting them in an electronic data collection tool that you don't have to manually tabulate your results, that there's some report somewhere that's actually calculated for you. Now, the next few slides actually outline some questions to ask yourself. And I'm not going to read these and go through them, but I want to talk about the different kinds of highlights that your organization could or should be thinking about related to assessing sort of where you are on the population health continuum and where you are on the automation continuum. And this is set up. I didn't actually put the total scoring in this. The way the assessment tool is set up is there's 16 different items, and each of the items has a score associated with it. So you give yourself a score and a number of points in each of the assessment rows based on how you would answer the question. So, and you just go through it line by line. So related to your overall approach to your CHNA, you would give yourself 5 points in the right-hand column if your hospital or hospital system is collaborating across sectors to address root causes that impact public policy in the course of your CHNA activities. Now you'd give yourself 3 points if you're focusing on or working with in collaborative efforts to impact the broad health status of the community and beginning to address root causes. If you're doing anything related to the social determinants of health, you would give yourself 1 point in this item if your hospital is really only focused on an internal needs assessment and an effort to address healthcare-related needs only. You would give yourself a score of 1. And I have it parenthetically there, you'd score a 0 if you're only doing the CHNA because it's required by the IRS and for no other reason. So each of these items here have a score, and at the end you tally them up. And and then I have a descriptor on the assessment tool. If you score so many points, then you're really prepared to do this. You might already be doing it. If you're, a little bit lower score, you're not quite as prepared. But each of these items, and again, there's 16. The first one is the overall approach to the CHNA. The second one is related to population-based health planning. Is that something that you're working on at all? The third item is looking at the triple aim and the cost, quality, health status improvement items. The fourth item is program integration across the continuum, and are you doing different outreach, education, and prevention strategies that are integrated into clinical operations, versus are your education and prevention programs completely separate? And the reason why these various items are in here is because, as I mentioned, if you've seen the earlier webinars that we've done, is there's this evolution toward more collective impact, more addressing social determinants of health, and moving in the direction of value-based purchasing and being able to manage the care of a population. These are the various elements that we put into place as we go down that journey. Collective impact itself is one of the measures, and are you doing anything like that? Are you involved in community effectiveness? Do you have dedicated IT support? As part of your community health needs assessment activities, has someone from your IT department been designated as a support person to help you figure out how to automate these outcomes indicators? The CHNA's connection to the strategic plan, what your program approach is, and whether or not they're evidence-based, whether you have reliable metrics in place, how much of a strategic priority is it to automate the outcomes and impact indicators. One of the things that I found is that in program development in general, we often put resources into developing and implementing the program, but we don't put time and thought and attention into developing and implementing the outcomes measurement system, because there's time and resources involved in doing that, but that seems to be an afterthought. We don't plan for that at the beginning of a program or beginning of a project, and we should. And, to what extent are you tracking those outcomes measures? And are you looking at impact? Have you started embracing technology to measure the outcomes and investing in it? And are you conducting a formal evaluation? So the higher the score, the more prepared you are. But this little assessment tool sort of highlights the different aspects of readiness or preparedness and movement toward population health. But it's a good way of sort of highlighting and thinking about, how ready you might be to move in this direction. But whether you're just starting out, or whether you're working on the evolution and making your tracking systems better, the next few slides are designed to really educate you and those in your organization a little bit about how do we track impact across the continuum of care, and how well developed are our outcome and impact measurement systems, and then what can we do to improve them regardless of where we're starting from. So the next few slides really highlight that. So if you want to improve your measurement capability, and you've got to start by identifying your indicators. So the first step is you want to develop the logic model. We talked about that a few sessions ago. You want to really look at what your outcome and impact measures are, and what are the variables or the pieces of information that we want to collect in order to be able to measure that outcome and impact. Then you want to talk to your IP professionals to create some type of data collection and reporting system, ideally through existing electronic applications and software. There's lots of technology operating in most hospitals and health systems today, and the best approach to data tracking is using the systems you already have and augmenting it with the additional information that you need rather than coming up with a new data collection system. Then you want to develop some type of progress report where you put all your data together and then discuss and document the informatics development as part of your action plan. While the IRS regulations say that there has to be a plan to measure the outcomes and impact, the implementation plans themselves often don't include those action plans. So at the end of this session, we're going to talk about, well, how do we create that action plan to automate these outcomes indicators? So where do we start? As we talked about in the logic model session, we look at our process and output measures. We identify what our outcome measures are or our impact measures, finding a logic model or using a logic model. And here's an example of a logic model for a breast cancer program that includes the inputs, the activities, the outputs, but looks at the short and medium and long-term outcomes, the number and percentage of people that follow up on screening results and receive mammograms. Some people are tracking these things manually. Other people are working on tracking them and automating them across the continuum, the number and percentage of people diagnosed with cancer at each stage, et cetera. These are, outcomes measures. This is just another way of looking at the same logic model, organizing outputs, outcomes, and impacts related to a cancer intervention strategy. These are, again, different examples of indicators that you could track if you're doing a program like that. Here's an example from Ohio. A couple of years ago, the state of Ohio actually mandated that all of the hospitals in Ohio start to report the PCMH quality measures, which is the patient-centered medical home, those quality measures that were established at the national level. And most of these measures are included in electronic health records somewhere. They tie them back to Ohio's top 10 health priorities and basically said, okay, hospitals, these are the top priorities for the state. Most, if not all of these, are priorities in your local communities. We expect you to report these indicators to us as part of the impact of your CHNA implementation strategies. So at the highest level, these are the things that are going to make a difference. These are great indicators that may already be in your system that your hospital system is reporting to the federal government and maybe even to other entities that you could be using in terms of your reporting, but you may not have a reporting system in place to get that data out of there. And I'll give you another example. Kathy, my colleague, and I did some training for a healthcare system, a pretty large healthcare system, where they were looking at developing outcomes measures for certain programs that they were doing. And when we took a deep dive into what were their logic models, what were the outcomes that they were looking for, we took a look at their medical records. And within this hospital system, they were actually running Cerner, Epic, and one of the other, they had 3 different software programs, so they weren't all the same. But what we discovered was that even though they were running 3 different medical records in various hospitals in their system, the variables for the outcome indicators were almost identical, even though they were placed in the electronic medical record system a little bit differently. They were all there. for the most part, the data was even being captured by people. The problem was there wasn't a reporting system. There were no reports created with those variables that managers could see. And that's a very different need than if you have no indicators anywhere. So you want to start looking at your indicators and start asking the question, do we have these anywhere in our system? And I put in here an example. This example actually comes from Rosebud Health Care Center, which is a critical access hospital in Montana. And this is an example of what one of their implementation strategies look like, and the reason why I'm using this example is that it's pretty generic, and they're activities that a lot of different hospitals use in their interventions. They're doing health fairs, they're doing community education, they're providing information about what's available in the community, and it's awareness type activities. So we have these strategies. The next slide actually shows what the action steps are for, one of the first strategies, and then lists a number of indicators that could be used to measure and evaluate the impact of those activities. Now, you don't have to use all of these. You can use a few of them, but you want to take your implementation strategies, look at your outcomes and impact, and then figure out what items you actually want to measure, whether it's not only the number of people, but the number and percentage that follow up, referrals to physicians, referrals to a specialist, people who attend, increased knowledge. Okay, so those are the indicators. So once you know what your indicators are, you want to then ask the following questions. Does the outcome data already exist somewhere in our electronic system? Even if it requires work to find the data and combine it across systems. Because oftentimes, we have one system for outpatient and one system for inpatient, and we have a different system for registering radiology patients, right? And so there may be some work involved with putting those together or figuring out how data comes from one place or another. And there are usually, most hospital systems even have somebody in their organization that could put those pieces together and create a report if the request was made to do it. So if the data doesn't exist, how can we create a process to get it? That's a little bit more complicated, but possible to do. And one of the things that I would encourage you to look for, especially in electronic health records, if you're looking to automate them through that, what I found is that oftentimes the best outcomes information that's being collected ends up being text fields in the nurse's notes, and they're not queryable fields. They're not a number or a category that can actually be queried later. You want to be thinking about that as you work on the automation. So when you start thinking about, talking to your IT friends, you do want to start at the top. And it is very helpful to get the blessing of the most senior administrator, whether you have a CIO or a director of information systems or technology, to put the right IT professionals on your team and have them help you. What we've found is that, once we start asking questions, there's a guy or a gal somewhere in the system who knows the system where the data might be located. You've got to find out who that person is and identify that person who knows and understands the construction of the databases that support the continuous care. Now, depending on how your hospital is structured, that person might be in medical records, it could be in information systems, it could be in database administration, it could be in financial planning or financial analysis, or informatics. And we found that they could be in any of those places, again, depending on how the organization is structured. And then you want to determine the variables or the elements that you want to track and report and determine whether they're captured anywhere. You want to ask the IT professional to understand the process flow. So what do I mean by that? So let's go back to the breast cancer example. If we're talking about tracking breast cancer patients from screening through mammography, possibly to surgery, you want to explain to the IT people where the people are going and how you want to measure what's happening to them. Because most IT professionals, they are trained to think in work process flow and how to capture data at points along the way and set up variables to report it. And they'll tell you pretty quickly if the software has the capability to do what you're asking, or if some report would have to be created across softwares or interfacing softwares, or if you have to find a data field, if it would need to be modified. Because sometimes, depending on your organization, you may have the IT professionals in your organization that can modify the fields. But in some cases, you'd have to contract with an external software vendor to be able to do it. And in some cases, I've seen organizations that have to contract with external vendors to create reports. But you've got to figure out what your current state is and whether or not you would need to do the report internally or externally. But generally speaking, it can be done. You just have to find the right person in your organization that can do it. And one of the difficulties often is that the IT people in the organization are stretched relatively thin themselves, and they simply don't have time to be able to work on it. That we've seen that in some organizations too. And I'm going to talk about that in a bit as part of one of our case studies here. But I'm going to illustrate for you a couple of case studies that we've been involved with or worked on or know about to help illustrate kind of examples of the process and what the final outcome might look like. So one of the examples that we want to talk about today is from St. Vincent's Hospital, part of the Allegheny Health Network, which is actually in Erie, Pennsylvania, where our home office is located. We actually worked with them a few years ago on their CHNA, but found that they had an informatics guy there who was doing some pretty cool reporting that was really neat. And what's interesting about this is the report, when St. Vincent started down the informatics road, the reports were typically data dumps from system databases to spreadsheets. That's what happens in a lot of places, and only the most savvy Excel users could use them, and many of the reports were ignored. And the electronic health record was only used to capture info on a patient visit, but it was rarely looked at. And a medical director realized that the hospital was losing out on population health incentives, especially programs from insurance companies. And they looked at the fact that there was a wealth of information that was in the electronic records already that could be used for reporting, but they really weren't looking at it. And we figured out how to marry this approach with all of the different community health needs assessment indicators, because diabetes was a high priority for the organization. So what they were able to do was develop multiple reports, and part of the handout materials that you'll get with this presentation is actually the deck of the reports that were created and some explanation of all of them. They developed multiple reports that help providers understand their populations, help patients understand their health and progress toward their goals, and they increased primary care reimbursement $12 per visit because they were doing so this project actually more than paid for itself because they got additional reimbursement in addition to getting these indicators. But what they did was created a series of reports related to diabetes management, which are the outcomes and impact of both diabetes education programs and diabetes management. So The next couple of slides actually show this was an appointment information sheet that would print out when a patient had an appointment. This report that had all the patient's recent lab results would print out and be waiting for the doctor on the printer the morning of the appointment. And they would also do things like track their blood pressure, track their weight. These were other indicators that were done. Again, these are at the patient level. And their smoking use, whether they were smokers, these are at the population level of all of the patients in the diabetes program. And what they learned from doing that is that you want to connect your CHNA efforts to your clinical practice and population health planning. Because if you're just looking at, well, I need to figure out whether my diabetes education programs are working, look at all of the patients that you're really supporting with diabetes and put some effort into reporting on them as a population. Identify the physician and the clinician champions that are driving the patient care delivery process. You could also look for financial incentives available in the system to help make the case for IT investment in the reporting and data extraction design. So there may be potential rewards for the organization if you do this right and connect the dots, and then find the right IT professional skill set, because those reports, although they look very impressive, are done with some basic SQL database reporting tools that when I talk to my IT friends, are not all that terribly sophisticated, but they give great information. And when you're looking for the right IT professional, if your hospital system doesn't have someone who is the term is a database administrator, there's some specific skills and some general skills that you want to look for if you're looking to put somebody in that position. You want somebody who has the ability to write queries and extract information, somebody who can write reports from applications such as SAP, Crystal reports, Excel and Excel pivot tables, and the general skills to be an internal facilitator or consultant to help support the process internally. These are all really important critical success factors. Now, if you want to create an indicator automation action plan, some of the steps that you would want to think about are, first of all, to identify the outcomes and impact indicators associated with each implementation strategy. As we talked about, determine whether the indicator exists and if the data collection approach needs to be developed or both developed and automated. And then look at the work process flow of the data collection and then incorporate the orchestration into your to-do list. Well, what do I mean by that? You want to review each China implementation strategy, look at those measurable outcomes and impacts, figure out whether the indicator is automated, and then automate it and report each with an implementation strategy. So what does an action plan look like if you're creating one? We recommend doing it on kind of on a line-by-line basis if you want, of those indicators that you want to automate. So, for example, with this particular health system, they wanted one of their key indicators was the discharge patient distress rating, because they wanted to look at pre and post intervention of the nurse navigators. How is patient distress really going down? And they had the variables. They had a distress tool. They were using it at the beginning. They wanted to track it pre and post, but they didn't have a way of capturing the discharge event. So they figured out what needs to be created, okay, and what indicators needed to be automated. So you go through each item and figure out, well, what needs to be done to capture the variables. And then what you do is you look at, okay, so I want to work on the post-discharge patient distress tool rating. What are the activities that need to be done in order to accomplish that? Well, we've got to determine the point in time and which staff member are best suited to administer the tool and actually get the data in there, and who would be the responsible person. We've got to talk to the clinical supervisors about the importance of administering the distress tool. So this is a process action plan that outlines the steps to be done to actually facilitate the process change to get the data collected and then get the data into the electronic health record so that it can be measured and reported. The next page actually talks more, it's a different indicator, looking at the cancer program no-show rates and talking about that. So these are the steps to actually get the cancer no-show rates automated and addressed as part of the process. So what are some of the key takeaways from this learning? First, you want to determine your understanding of how patients flow through the continuum. You want to identify your measures, talk to your IT professionals about how the data can and will be collected and reported, determine what currently can and can't be done, develop an action plan to collect and automate the data reporting and incorporate it into your strategy, and then track your progress and evaluate your results. And one of the other hospitals that we're familiar with that was working on automating indicators, they actually applied for a grant from a foundation that helped them increase their IT department capacity in order to address some of the automation requirements that they had and that they wanted to work on. So if you're in a situation where there really isn't the bandwidth or the capability to help automate your indicators, that can be an approach to help you do that, especially if you're working on programs that are collaborative within a community and you're trying to assess collective impact. There are resources that can help support that process if you're interested in doing that. And with that, I will ask if there are any questions. I see one question that has come in via the chat feature that asks, what happens if you're in an organization that doesn't have good capabilities to do reporting? What can you do? Well, that depending on how your organization is structured, that may be complicated. And depending on how, and I guess what the approach is. And I'll use an example from another client that we're working with, not a hospital, because this happened. This is something that happened recently. The management team identified that they needed a variety of different outcomes indicators in their software to look at the efficiency and effectiveness of a program that they were running. And their IT system probably had none of the variables in it that they were collecting that they could actually measure it. And I actually recommended to them that they hire a consultant to, just on a project basis, that was someone who had been a database administrator and who had knew how to do crystal reports and was familiar with SQL databases. It really didn't matter that they didn't have to be an expert in that particular software. They had to have those skill sets that were database administrator skill sets. And they were actually hiring an IT staff person anyway to help support their normal operations. They added these additional skill sets to the hiring request for a person that they were already bringing in. And what they found was that this individual could pretty quickly get up to speed on this software that they hadn't been familiar with previously, and was able to, in pretty short order, start to write some reports and get some information out to folks that they weren't able to have before. And they're finding that this long list of variables and information that they didn't think that they could track, and that the information wasn't supporting what they were doing, this individual expects to get all of those changes made to the software within the next 3 months. So it's going to get done pretty quickly, and in addition, with an internal staff member. So that's one approach that you could use when you're in the situation that if you don't have somebody in-house, you can try to get that and build that capability. Any other questions? I am going to unmute everyone.
The conference has been unmuted.
And I'll ask, are there any questions that anyone wants to verbally share before we close the webinar for today? Okay, then. I'm going to say thank you to everyone for participating today. I will stop the recording. Have a wonderful rest of the day.